Hi everyone, welcome back to It's Not TMI. My name is Lisa Flanders. I'm a physiotherapist in Ottawa, Ontario, and I practice within women's and pelvic health. Today on It's Not TMI, we're going to continue talking about some of the pelvic pain disorders that we commonly see in the clinic. Specifically today, we're going to be talking about vulvodynia. Vulvodynia is a little bit more of a specific term that specifically talks about any form of pain in and around the vulva. And if you watch my very first video about the vulva, I go through all the different parts. We're going to do a quick little refresher right now using my vulva puppet. So just a reminder that the vulva is what we can visually see when we look at our genitals. This is my vulva puppet. It's a pretty good way for us to go through some of the parts really quickly. So we have our clitoral hood and the clitoris. We have the labia. This is the labia minora, labia majora. And then we have the perineum at the bottom here. So this is going to be pain anywhere around that outside area of our genitals. Vulvodynia specifically is going to be referring to pain in and around the vulva. This might be also related to pain with intercourse, like dyspareunia, or just generalized vulvar pain. Often people will describe that pain as itchy, sore, raw, throbbing. It might be occasional pain, or it might be something that that person experiences all the time. Often individuals will talk about how different clothing feels uncomfortable. They might not like to wear pants or specific types of underwear. They might feel most comfortable in a long skirt where they don't have to wear any underwear underneath. Much like all of our pelvic pain disorders, there can be many different causes for vulvodynia. This can include injury, infection, allergies, sensitivities, hormonal changes, and there can be pelvic floor muscle involvement. And I'll tell you a little story about myself. I did experience a very brief period of vulvodynia following laser hair removal. I went for laser hair removal, was driving home afterwards. I had searing pain in and around my vulva. I actually had to drive with my pants lowered a little bit around my bum just because the pressure from my underwear was so uncomfortable. I used a cold compress and I took some anti-inflammatories, and luckily within about 24 hours those symptoms resolved. So again, it is very common and sometimes the cause can be unknown. And I was very fortunate that my experience was very short term, and most people living with vulvodynia are going to have symptoms that last much longer than that. So how do we treat vulvodynia? Like all pelvic pain disorders, it's going to be very necessary to go see your primary healthcare provider so that we can rule out any form of infection, including STIs or other skin conditions, including lichens, sclerosis, or eczema. When someone comes into our clinic, we always go through our vulvar care and hygiene tips. And again, this doesn't mean that having vulvodynia means that you're unhygienic. It just means that some of the things that you're using might be irritating your vulva. This can include harsh soaps. It can include the type of fabric that you're wearing. So if your underwear is not made out of a breathable fabric, if you're wearing pantyhose, or if you're using lotions, and again, the type of cleaning products that you're using in and around your vulva, yourself and or your partner, because what they're using can also rub off on you during penetrative intercourse. Other things that can be helpful is applying a cold compress to the area, especially when you're in a flared position. Speaking to your physician, you might be prescribed some form of medication, either a topical medication or an oral medication that's going to help with inflammation and or discomfort. Again, looking at all the products that you're using within your house. So looking at the laundry detergent that you're using, the body wash that you're using, the lotions that you're using. Trying to switch over to cotton underwear if at all possible, and or sleeping in the nude is really important. If you're experiencing vulvodynia, using a lubricant during intercourse can be very beneficial. And what you're looking for again is those organic type lubricants without any additives in them. And typically the oil-based lubricants can add a little bit of a barrier between your skin and the tissue of your partner. And because vulvodynia can be very uncomfortable, it can be something that is very ongoing, it can cause a lot of stress and anxiety in a lot of patients. Therefore, we typically will recommend that they speak to some form of talk therapist or undergo some form of talk therapy to help them cope as well. I really hope that you found this video helpful. Vulvodynia is quite common, and just know that you're not alone. It can be a very frustrating thing to experience, but finding the right healthcare team can really help you through and lessen your symptoms. I really hope that you found this video helpful. And if you have any questions that you think might be TMI, feel free to leave them in the comments below. Have a great day.